If you have an active toddler or a kid in contact sports, you should know what to do when your child sustains a concussion. In this video, we will talk about what to do when your child gets a concussion. We'll also talk about the importance of physical and mental rest. And we'll also talk about how to safely go back to school and go back to sports. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Concussion management in kids. What is a concussion? It is a traumatic brain injury that disrupts the normal brain function. It can be from a blow or a bump or a jolt in the head or a fall or any injury that jars the brain. What happens is that from a concussion can lead to changes in the normal physiology of the brain, which disrupts the brain's mental function. Concussion can be accompanied by loss of consciousness, but majority do not. What is important is all concussion is a traumatic brain injury and should be taken seriously. After your child sustains a concussion, what should you do? First off, monitor for worsening signs and symptoms in the first 24 to 48 hours. If there is any danger sign present, your child needs to be immediately evaluated by a doctor in the ER. These include severe or increasing headache, if there is double vision, if your child has unequal pupils, if there is unusual drowsiness, if you note convulsions or seizures, if there is continuous repeated vomiting or projectile vomiting, if there is bleeding or clear fluid draining from the ears or the nose, or if you note personality changes, or if your child has weakness or numbness. Second, do these things. Do not let your child do any strenuous activity or go back to sports. Also, do not give your child aspirin or ibuprofen in the first 48 hours. Instead, give your child acetaminophen or paracetamol as pain relievers. Also, encourage your child to rest and eat a light meal. And also, you can put ice packs on your child's head to make him or her more comfortable. And also, let your child sleep in a cool, dark, and quiet room. Thirdly, have your child evaluated by a doctor who is trained in concussion management. The old practice of waking your child up from sleep every hour to check up on him or her is outdated practice, and you don't need to do that. The road to recovery from a concussion. Well, concussion affects your child's school and sports. And in your child's recovery, everybody should be involved. You, mom and dad, the teachers, the coach, your school nurse, and the guidance counselor. Everybody should work hand in hand to help your child go back to school and to sports safely. Now, how to go about mental rest and physical rest, how to go back safely to school and to sports. But before we talk about that, are you expecting a baby? Or you already have a newborn? How much better life can be when things are under your control upon baby's arrival, where you feel confident and know what to do and what to watch out for when breastfeeding your baby. Is baby getting enough milk? You know how to soothe a crying, fuzzy baby, when you know when to worry and call the doctor, where you can better take care of yourself because you understand your baby's sleep schedule, where you can learn to recognize postpartum depression. You can have the training at the comfort of your home. I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. Mental rest is important in a kid with concussion. Concussion affects how the brain works, and resting the brain as much as possible is important for your child's recovery. Mental activities, what we are referring to are those activities in which the brain needs to work extra hard to process information. Activities such as problem solving and critical thinking, which are involved in schoolwork, homework, and use of technology. And so, how can your child achieve mental rest? Consider restricting or limiting the activities that increase the brain's function, worsen your child's symptoms, or delay healing. This can be from computer use or internet use, playing video games, television use, text messaging, use of bright lights, loud noises, parties or concerts, driving, and schoolwork as well. Now, how do we know if your child is using his or her brain too much? Well, especially in the first few days after a concussion, it is normal for your child's symptoms to be severe. At this time, it is okay to suspend your child's mental activities, which include schoolwork and homework, and have your child rest at home. Then, if your child's symptoms have improved, you can gradually increase his or her mental activities. You can have your child do schoolwork and monitor for symptoms. If your child is having a good day, then your child can continue doing schoolwork. But if you note that your child's symptoms have worsened, have your child take a rest for about 20 minutes and then try to go back to schoolwork after that. It is normal that there will be some good days where your child may be having mild symptoms or symptom-free, and there might be bad days where your child's symptoms are bad. It is just a normal part of recovery. Physical rest is also important for your child to recover. Physical activity is any activity where there is an increase in your child's heart rate, and these activities include sports, gym, weightlifting, and active play. We limit physical activity because of the risk of second impact syndrome and complications after a concussion. So if your child has a concussion, it is important that your child should not have any physical activity and no sports before being cleared by a physician. This is important to keep your child safe and for your child's brain to heal. Schoolwork is also affected because schoolwork demands focus, memory, and concentration, which are all brain processes that are affected by a concussion. So it is necessary that your child might get academic accommodations, and this can include necessary absences to tutoring or extra time to take tests. So notify your teacher if your child has sustained a concussion, and you may give written recommendations from your doctor. So your child should be symptom-free before going back to school fully. And how about sports? Once your child is cleared, your child can gradually, progressively return to activity. And it is better that your child is monitored by a certified athletic trainer. Hey, if you liked this video, watch my next video where I teach you about other child health problems.